Okay, good morning, councillors, officers, members of the public and press. Welcome to this meeting of the Outbreak Response Working Group. This meeting is a remote meeting and it's being live streamed to our website and recorded. I will now hand over to Denise Winpenny, Democratic Services team.
Thanks, Chair. We'll begin the meeting by way of a roll call of all those in attendance remotely. And may I request
Peter Graham, Cleveland Police,
is now joining.
They have a paper copy of the agenda and can both hear and see councillors in the meeting. I now begin the roll call. Councillor Moore.
I'm here and I have all of the relevant paperwork.
Councillor Thomas. Councillor Harrison. Denise McGuckin.
I'm here and I've got the paperwork.
Dr. Tim Butter.
I'm here and I've seen the paperwork. I've only got about 20 minutes and then have to dial off, but I'll listen in for these 20 minutes. Thank you.
Michael Holton.
Yeah, hi, I've got the papers and I can hear and see everyone, and I've got a dial off as well at about 22.
Leslie Wharton. Greg Blundred.
Yeah, I'm here and I've got the papers, thanks.
Thank you. Sally Robinson.
Yeah, morning, I'm here and I've got the papers.
Superintendent Sharon Cooney, I've received apologies and I understand there'll be a substitute. Is that Pete Graham, I understand?
Yes, you got Peter Graham. Unfortunately, I haven't got the papers. I'm just searching for them.
Thank you. Jill Harrison.
Yes, I'm here and I've got the papers, thank you.
Tony Hanson.
Morning, Denise. Yes, I've got the papers.
Ed Turner.
Yes, morning, Denise. Thank you. I've got the papers.
Christopher Akers Belcher. Julian Penton. I understand I have apologies. And is it Julie Simons, a substitute? Is Julie present?
Yes, I'm here
Graham,
and I have got the papers. Thank you.
Is now exiting.
Thank you. Jacqueline Mackenzie.
Morning, yes, I'm here and I've got the papers.
Fiona Adamson. Graham Trory. Carl Parker. And I'm not sure if the Faith representative is present. Is there anyone I haven't called that is present?
Hi.
Councillor Young.
Councillor Young, thank you. That now concludes the roll call.
Sorry, I was just going to come in. It's Dominic Gardner from TSS Conway Valleys. So I've had the invite to this meeting forwarded to me by Sean Mayo, who normally attends the Outbreak Working Group. So I'm just covering for him. He's on leave today and I don't have the paperwork.
Thank you. And I understand Councillor Tony Richardson is also present. Thank you. That now concludes the roll call, Chair.
Thank you, Denise. Moving on to agenda item 1. Do we have any apologies for absence that hasn't been, communicated with Denise there? No. Okay. Next one then, the minutes from the previous meeting held on the 11th of September. Are there any questions or comments arising from those minutes? If not, are we happy to sign them off as being a true record? See no dissent. Okay, thank you. Okay, item number 3, the coronavirus data update from the Acting Director of Public Health, Craig Blundred.
Actually, thanks for that. I think we've got Dean on, who's our analyst, who's actually going to go through the data with you, and then I'll add anything in after that. So, Dean, if you're there, are you able to go through this now?
Yeah, I can go through.
Thanks.
So this is the current Hartlepool COVID-19 situation. Can we have the next slide, please? So this is the COVID case rate. This is the figure per 100,000 for both England and Hartlepool. And as you can see, around about the 19th of April, Hartlepool overtook the overall England case rate and has been that way ever since. There was a period from May into August when the increase for Hartlepool was very similar to the increase of England overall, but since the end of August, Hartlepool has started to pull away again, and now has the biggest gap between its rate and the overall England rate of this whole COVID period. It has gone over 1,000 cases in the last few weeks, which is obviously an important figure. You will have seen that there's been a data dump by PHE over the weekend where there was quite a large amount of cases that hadn't been included in the figures. So we may see the case rate jump up slightly, and we'll have to take that into account. Can we have the next slide, please? The weekly cases. Now, while the figures may be very, very different, obviously England's up at 30,000 a week and Hartlepool's up at 100 a week. The pattern was basically the same in the early part, the first wave, if you will, whereas in the period since August, certainly the week of August, the third, Hartlepool's increase has jumped significantly in a way that England's has not. England has seen a much more smooth increase, whereas Hartlepool's has jumped up, which is of concern. Next slide, please. So as you can see here, the rolling 7-day averages really highlights the difference between the England increase and Hartlepool's increase in the period since the end of August. The first wave again, we can see that Hartlepool was higher than England for that April May period, but had fallen back into line. But in these past few weeks, Hartlepool's 7-day average rate has increased in a way that England's just has not. Next slide, please. Whereas the death rate, again, quite early on, Hartlepool overtook the England average, but this one has stayed roughly in the same rate as England. There hasn't been a great deal of COVID-related death recently, and both England and Hartlepool have had fairly static COVID death rates for quite a sustained period of time now. Next slide, please. So these are the locations of Hartlepool's cases. So this is all of the cases. As we can see, as you would expect, the geographical strip on the eastern part of Hartlepool, where the majority of people live, is where the majority of cases are, funnily enough. And that period to the left of Stratton has seen the highest concentration of cases for the whole of Hartlepool. It is worth pointing out that a lot of these concentrations relate to the locations of care homes as well, which we saw in that first wave, where the majority of cases were in the older population, and the care homes were hubs of cases almost, that caused some of these darker patches, which we are not seeing to the same extent with the latest wave, because it tends to be those under 40. I think about 52% of the cases in September were those under 40, which is very, very different than the breakdown of the cases in that first wave. If we go on to the next slide, we can see where the cases were for September. So it's a similar pattern as a stronger presence in the northern area of the town, so the Hart Station area, has seen an increase in cases, certainly an increase in concentration of cases, but that wasn't there in that first wave. But generally, given that Hartlepool's population is concentrated in a very small geographical space, you're going to see roughly the same pattern whenever there's a high concentration of cases, because there isn't that much of a geographical area upon which you can spread these cases out. But the care homes, as you can see, are playing a smaller part in the areas of concentration, as I said, because the cases this time tend to be in the under 40s rather than the over 60s. Any questions?
Thank you, Dean. No, there's none from me at the moment. Is there anybody else, any other board members who wanted to ask Dean anything there about the presentation? No? Looks like you've got no flight, indeed. Thank you very much. Thank you for all the work you do. It is appreciated. Okay. Was there anything further to add to this, Craig?
Yeah, I think it was just to flag up a few bits around where this links with the national picture as well, because I think what we're also seeing within the data is that it reflects the actual numbers reflect how it was earlier on in the pandemic as well, and we're also seeing those areas that had higher nationally, those areas that had higher rates of cases are also now starting to see an increase in their rates as well, and again, it's probably down to those underlying factors. Which are not being addressed as well. So I think we're not that different from other areas in that respect as well, which I think is important to reflect on. But clearly it is a concern that the numbers are increasing as they are.
Thanks, Craig. Okay, last opportunity for anybody to ask any questions on that presentation before we move on. Thank you then. Item number 4, you again, Craig. That's for the position update.
Yeah, thank you very much. Yeah, and again, this is probably the main reason why we brought this meeting forward as well, is to discuss the current situation we have at Hartlepool at the moment. You'll all be aware, no doubt, that because of the increasing numbers we've seen within the cases, that as from Saturday, Hartlepool was put under local restrictions, which are very similar to those restrictions which were earlier placed on the LA7 local authorities in the northeast. So that means we moved from area of concern and enhanced support to the local restrictions, which has a much more significant impact on what we can do within the local area. I won't go through all of the restrictions because there are quite a number, and they are available on the government website, but sort of significant elements include social contact restrictions around not being able to visit people within their own homes. In your own homes, you can't meet with people you do not live with in your home. Whether inside or outside affected areas. You can't meet with people you don't live with in indoor settings, whether inside or outside of affected local areas. And you can't host people you don't live with in your home and garden. So there are some quite significant restrictions now on social contact. And that was reflected as well in terms of meeting people out and about, in terms of meeting people in pubs and bars, restaurants and the like. And so there are additional restrictions that are now in place as from Saturday. Regarding who you can meet or not meet within those venues. There are also restrictions on businesses around about particularly hospitality venues for restricting food and drink sales to people who are seated, and many restrictions along those lines. And there are also subsequent restrictions around travel, such as non-essential travel is restricted as well. Those are kind of just the key headlines, but again, I would recommend that people go and look on the government website where there's a full breakdown of all of the restrictions. And again, the main reason that we brought this meeting forward is obviously there is significant work that needs to be done in terms of how we communicate those restrictions, but also about how we work with our community to make sure that the restrictions are successful. Again, I think it's going to be hopefully not become a cliche, but this is a joint effort, and we are all in this as one across the town and across the borough, and that's how we would like to make it moving forward. And what we really need is the support of the whole community to really ensure that the restrictions have an effect. We don't want these restrictions to continue longer than they have to. And really the key to this is to really, we don't have a clear exit strategy at this point in time, although we are waiting for advice from the government, but clearly getting the numbers down significantly will help us come out of these restrictions sooner rather than later. And clearly everyone has a part to play in reducing those numbers as well. So really what we need to do is look at how we get the messages out there to the public, but how we also work with the public as well. I'm really clear that this isn't a top-down approach we need to take to engagement. What we need to do is work with the community, work with all our different communities so that we get buy-in. And also that we bring people along with us. And so we want to start looking at a program of work that really engages with our population and really helps. Because again, I think we are going to see sort of a challenging time coming over the winter. We know that's going to happen. We're possibly seeing the start of it now, but actually if we work with our communities, we're going to have a much better chance of keeping the numbers as low as we possibly can, but also sort of not have any of the additional burdens that we face with the additional winter illnesses that we see. So we really need to start thinking about, as much as we can, a real community effort in terms of engagement and developing comms messages as well. And really, that's not something we can do on our own as a local authority. So we really do need the buy-in of all of our partners to do this. And realistically, we need to really understand how we can work together to embed the messages within the community, but also put in place support as well to support people who may need that additional support to meet these restrictions. So essentially, there are several areas where we think that would manifest itself. Particularly, we need sort of key people in the community to pick up the message and work with us to support that. And I think we break that down into different groups. So, for example, we see a very key role for ward members to be that key source of information and support within the community and putting positive messages out there and having a sort of two-way process back into the local authority so that we're able to understand what's happening on the ground, which I think is going to be crucial to us. We also need to look at key community leaders as well, in addition to that, in the community. And we hope that we can work very closely with our community and third sector partners to look at how we develop that work and actually think about how we can bring together champions to support the work, but also engage with our communities as well, so that we get good, clear messaging, but also we get that feedback again from the communities in a timely way. So we need all of those key leaders, and we need to try and bring them together with our key messaging. So it's also vital that our messages are very clear, that we send out, and very clear about the restrictions, and also about they link to the national messages that are coming down. It's a challenge in this world of social media and lots of misinformation flying around, but we really need to get a handle on all of the information that's coming out, just so that it's clear to people what they need to do. Because if people don't understand what they have to do, it makes it much more difficult to put in place those restrictions and to abide by the restrictions. And the last thing we want is confusion about them. So we've got to look at how we come up with clear and consistent messages, but also it's not about we're all in this together, and I think that's going to be the message that we take forward. And it's about how we can be positive and support people to abide by the restrictions, but also have a positive approach to this. It's not about being negative and saying what you should do, but helping people to meet those challenges that we're going to face as we move forward. So it's about how we can generally support the community and look at ways to do that. And I think we've had some ideas around that, in terms of potentially one of the ideas, as I say, is to look at sort of community champions who can work with this approach, and it has been overused, I think, a bit in the past, but actually there are some examples of successful guidance groups working in other areas that have done this, and I think now is the opportunity to really pick up and run with some of these processes and programs, and I think now we've moved into this period, it's more important than ever that we're actually able to communicate these restrictions, but also start this work building on the strengths we've got actually within the community, because we know there are a lot of strengths out there, and look at potentially an asset-based approach to doing this as well. But we can't do that on our own as a local authority. We need to engage with our partners to do that. So I guess really this meeting is the first part of those discussions in order to get some feedback from yourselves, and also to actually, my aim from the end of this meeting is for us to have a plan that we can take forward and some commitment from partners to take this work forward. So in the next week or so, we can start to formulate that plan and that process. So first of all, I think it would be useful to find out from yourselves whether that's a good idea, but then also get some feedback on those processes as well.
Thank you, Craig. I think just before I open it up, it's probably worth saying that for some people, especially some of the voluntary organisations, if you've seen some of the response from certain quarters in relation to these restrictions and how they came about, you may be quite reluctant to dip your toes in and get involved in that fight, and we completely appreciate that. It's not an easy one, and it's not going to be an easy message for us either. But I think for us, what's important is that how we got here, and we got here because last Monday we were pretty much told that we were going to have restrictions put on us, but we were invited to sit around the table and to try and put an ask in place and to see how we could help shape that. And as an authority, we tried to do that, which would help us bring the numbers down in a targeted way of using the data that was available to us, but at the same time limit the much stricter restrictions put in place elsewhere. Unfortunately, that hasn't been the case, and we failed in that regard, and we are where we are. But I think it's just important that unfortunately these were coming anywhere, and that will be the case for other areas as well. But we really do need some help on trying to get this message across, because we want to be out of this as quickly as possible, and I'm sure we would all like some kind of normality as we head towards Christmas. Councillor Harrison.
Thanks, Chair. Can I first of all apologise for being late? The internet, one of those things that you have to deal with these days, and I wasn't on, so I've had a bit of a problem. As for what I came in just before Craig did his last presentation, and I totally agree with everything that's been said. But as Shane's pointed out, and he made it quite clear in his interview on the television after these restrictions came in, that it wasn't the local authority who put in all these restrictions. So I'm sorry to have a negative slant to this, but I don't think we can always be as positive as we would like. Probably in public, I'll be more positive. But within here, I think we need to address the fact that people are really fed up. And if the likes of me are fed up, then there'll be a lot of other people fed up. I've been very supportive of restrictions. I've been very supportive of everything that's gone on. I think we as a local authority have done an extremely good job throughout this. And I think this is just making our job very, very much worse by putting such stringent restrictions on. It's actually worse than the first lockdown. In the first lockdown, you could, if I understand correctly, go into someone's garden. I didn't, but I think you could do that. We have a situation now where I could actually, I think, sit at a table outside a pub, and my brother could sit at another table outside the same pub, but I couldn't actually go into his garden. So it's a ridiculously stupid situation, and that's when people are getting really annoyed. And I think we have to address the fact that it's annoying before we actually think of how we can, yes, get the message across, but I think in a sensitive way, because I think they're draconian measures, which I think are unnecessary. And I think once people realise that they're just being put on in kind of for the sake of it, and because we can do this without any thought behind it, without taking any notice of the local authorities, you know, you're up against it. So we've got to address that, and we can't just say that that's not the case, and we've got to be very positive. I think we've got to realise how fed up people are, and me being one of them, I have to say. I haven't been into anyone's house, nor have I had anyone in my house for the last 7 months. So I have kept to everything that I should have done. And now I feel that the people who've been doing what they should are now being punished. And it's a very, very big problem. Sorry to be so negative.
No, you raised some really good points, Brenda, and that's the point. And it's what many of us have shared. We need to start explaining some of these restrictions as well. And the restrictions that can be explained, we should explain the rationale behind them, because some of them do have a bit of logic behind them. Others don't, but I won't go there. But Mike.
Thank you, Chair. Yeah, I think I agree with what you said. I agree with what Councillor Harrison said as well. I think businesses are under a tremendous amount of strain now, and I know that the local authority and the officers included are looking at ways to try and sort that out, and conversations with government are ongoing. But I think we're in a real random state, because we don't actually know how to communicate some of these messages, and I think Councillor Harrison's alluded to that. You know, the important thing now is if we're going to find a positive way of doing it, and I appreciate what Craig said, Craig said in terms of community champions. I think that is a good route to go down, but we've got to be clear on what the messages are and how those can be communicated positively. But from where I'm kind of sitting, we've also got to find ways of fixing things. So I was always taught when I did a business studies course back when I was 17 that there'll be 150 million problems, and it's the ones that you try to solve that are the key ones, and they'll be the priority. And I think that's what we've got to look at now. We've got to look at ways of fixing the problems and solving some of the issues. And I think with that in mind, we flagged up that the house-to-house mixing was the key issue. The data, whatever that data was and wherever that is, the data said that it was between households that this issue and COVID was increasing. So from my understanding, the government have put in further restrictions and tighter restrictions. But if we know that 80% of the issue is in one place, then my kind of ask is that we put a lot of the resources into that action, because I think that is where we need to target. And we must also be very, very careful in how we interact with businesses, because those businesses are under massive stress now and massive strain now because of the restrictions, and we need to support them and be positive with that, rather than enforcing and being quite brutal. And we've seen some of the national stories alongside this 4 minute past 10 takeaways being served with £1,000 fine. If we're going to get into that kind of rhetoric and that kind of nonsense, then we lose that potential for positive messaging. And I think we need to be very, very careful in how we conduct all of this.
Great, thank you, Mike. Julie Simons.
Hello there. Yeah, hi, my name's Julie. I'm from Hartley Power. Just to pick up on the mention around businesses closing, we have a number of businesses in the hub and who are sort of enterprise who have opened up in the last 6 months. Some of them are thinking about closing in anticipation of things getting worse. So as was mentioned, I don't think there's that sort of positivity around things, and people are worried that things are going to go further downhill, and maybe we need to address that as well. just around the different levels of restrictions, the indoors and outdoors. I mean, I do understand why those things are as they are, and outdoor activity is a much lower risk than indoor is. As somebody who is part of team sports in Hartlepool and for their children, I'm very much glad that outdoor activity is still able to go on behalf of them, because I've seen teenage sons' mental health really sort of really lowering in the last 7 months, or them the ability for them be able to get outside. I'm not sure about sitting outside in pubs, but I do understand that that trade needs to go on. So as for the voluntary sector, I mean, we are happy to convene any meetings of locally based organisations if that would be helpful, and obviously to push any to push any media out through our media channels as well. Maybe it's like we say, we all need to be saying the same thing, and I do notice from social media engagement, the people who are really confused and they don't, like, they're not clear, they don't understand where they can and where they can't, and why they can do this and why they can't do that. So I think, as Mike said, if you concentrate on the main house-to-house transmission and getting the message across about that, just to put in I suppose an idea, we were supporting some sports-related activity within local organisations, and there we're building in like little instruction 10 minutes for the children and the young people involved, so for enable them to understand how to wash their hands properly, why hygiene is so important, etc., in the hope that once they'd finished their activities they would take that home as well. So maybe more of that around schools, rather than just insisting on maybe his regular hand washing. Maybe they held a session throughout schools. Sorry, that's not really community organisation related. Yeah, no, just to mention, yeah, I think just we could do what we can really to get things out across the community organisation. They're doing the best they can. They're still going on, youth clubs and things like that are still happening, but they're on very sort of stringent operations, or half the people who usually go attending those now, and they're working with what they got basically.
Thank you, Julie. Can I just ask, while we've got people, I mean, this is going to have to work two ways. If we're expecting you to help us get this message out, we need to be quite open with you guys. So if there's anything you come across that you can't answer, or there's any type of message that you want to put out there but you need some information, advice or evidence on, please do come back to us about that, because we'll need to build that relationship, and we'll need to make sure what we're working with. Just while I do have you as well, though, this morning I've been pulling together a list of the commonly asked questions or accusations, some of them thrown at us over the past few days in relation to these. And I just wonder if there's any kind of burning questions that you guys might have that I've perhaps missed off my list here that we need to be looking at answering. Dominic?
Sorry, Councillor Moore, I suppose it's less of a, I'm just wondering whether there may be any questions around kind of wellbeing. And I know that Craig and Sean, who has been part of these processes, have talked about almost pulling together that description of what that mental health and wellbeing, what that mental health and wellbeing offer may look like. So it was just to say, I would imagine that alongside the message around the restrictions, we'd want to give some of the forms of support that will be available to people as well.
Great point, thank you, Dominic. Councillor Young?
I'll give way to Councillor Thomas on this occasion as the mental health champion.
Councillor Thomas?
Thanks, Mike. I think just following on from Dominic's point, I think one of the key messages that we do need to be getting out to people around mental health is that there is support out there, and the importance of accessing that support at the earliest possible opportunity. And one of the trends that is coming through at the moment is that mental health service providers are picking up a lot of new people to service, but people presenting with quite developed conditions due to the last 6 months. And it is absolutely vital that we get some of those messages out, that it is important, that there are people out there to help, and also to be getting out some of the sort of general myth-busting things around mental health, that mental health is something that 1 in 4 people will experience at some point in their life. And given the circumstances that we are in at the moment, it's probably going to be more than that at this point in time. So I think it's absolutely vital that we are getting out some of those key messages and promoting some of the places where people can be getting help around mental health. And I think the other thing that's important as well is there's also evidence coming through that people are still not presenting in the same numbers as we would expect, who have conditions such as cancers. And again, it's those messages around getting help early. Lots and lots of evidence, which we're all aware of, around the earlier you present with symptoms of cancer, the higher your chance is going to be that you are going to survive that cancer once that treatment package starts to happen. So I think the focus is obviously from this meeting around COVID, but there are so many other things happening around mental health, other conditions, which at the moment I think are equally as important around getting key messages out, around support that's out there and early presentation.
Some great points. Thank you, Stephen. Mike?
Yeah, as anticipated, mine is definitely linked to what Councillor Thomas and Dominic have said. One of the key questions that's coming through, certainly to myself, is around those places that are taking people in for mental health consultations and holding wellbeing sessions. And it is this rule of 6. And if the rule of 6, or if our restrictions are even further than that, how are these people supposed to access the services if the restrictions stop them doing it? So it's an important thing for us to acknowledge in terms of what Councillor Thomas has just said, and indeed what Dominic said, but it's also about what it looks like in terms of delivery and what messages we're sending out to mental health services in terms of how they deliver that service themselves, if it is indeed a session that requires more than 6 people. I'm thinking of things like group meditations and such like.
Craig, sorry to put you on the spot. Do we have any guidance on that yet, or is it?
I was just actually there having a quick look through that. I think I'll have to go back and have a look and see where that falls within this. I don't know if Dominic's got any other guidance that's come through from that, but I can't see anything specifically relating to that. But it's something we'll find out if we haven't got that already.
Okay, thank you. Dominic?
So just to advise that there's kind of lots of information that we've distributed since the beginning of the pandemic. And in terms of contact with our services, I think we're probably back up to around about 60% of our contacts are now face-to-face. So we're absolutely open for business, but it's all the comments are absolutely right. We've just got to keep reinforcing that message. And it sounds like we do need that concentrated piece of work with Craig, and also I think with colleagues from the VCS as well, to be able to describe what that broad offer is and what's available for people.
Thank you. Okay, thanks for that, guys. Is there anything else to ask or raise on that, on anything we've just discussed from Craig? No, thank you. I don't have any other business, I don't think. Denise does, though. Denise McGuckin.
Sorry, Chair, I didn't get my hand up quick enough. It was just in relation to your last question, really, and about asking all the partner agencies who are on the Outbreak Control Working Group to work with us to help get that communication message out there. We'll give some clear, concise messaging. We'll hold virtual meetings with Julie from Hartley Power. We'll be in touch to sort that out. We'll work with Chuve, but the people who, you know, like everyone who's on here, as we're all in it together, and we all have a responsibility to get that communication, because the sooner we get that clear, consistent message out and people start abiding by the restrictions, as much as we don't like them, we've got them, and then hopefully we'll be able to get out of this as soon as possible. So it was just really a plea to, if you receive a request from Craig or myself or anyone else from Hartlepool Borough Council, can we just have your commitment really that you'll help get that message out? Thank you.
Thanks, Denise. And finally, Councillor Thomas. You're on mute, Stephen.
Just to remind people that it is World Mental Health Week this week, and because of the pandemic, it won't be happening in the way in which it has in recent years with a big event at the Borough Hall. But we are trying to get some key information out, which is going to list some of the key service providers through pharmacies, Hartlepool Carers, Hartlepool Mind, Healthwatch Hartlepool are all involved. So hopefully we're starting that process this week about getting some of those key messages out that Dominic and Mike have referred to.
Okay, thank you. Okay, the date of the next meeting is to be confirmed, but I imagine the way things are going, they may end up being a little bit more frequently than we previously imagined. So thank you all for your attendance today. I look forward to seeing you all again. Take care and look after yourselves.
Thank you.
Thank you.
Bye.
Bye.